Hello and welcome. Today we're going to talk about what is mouth stuffing and why do kids do that. The first one we talked about how to handle it because it can be medically scary. The second part we talked about how to train your child so that you don't get in a situation that is very stressful or concerning. And today we're going to talk about what does it mean if your child likes to put a lot of food in their mouth. And what I find in all the years of experience that I've had working with infants and children with feeding and swallowing disorders is that the children that like to stuff their mouth full of food have primarily sensory issues, but they also have motor issues. So if you want to know what it's like, go ahead right now, stop the video, go find some food. Take the largest bite that you possibly can get in your mouth and start chewing. And what you're going to notice is that your jaw goes up and down in it's called a munching pattern, which is your least mature pattern of chewing. You can't possibly do a rotary chew, which is the more advanced chewing pattern. That's the rotary chew is the pattern that allows you to eat like chicken or broccoli or challenging more complex foods, and those tend to be the more healthy foods. And what kids that have or like to do a lot of mouth stuffing that have sensory issues is they don't really know where things are in their mouth, and if you put a ton of food in your mouth, all you have to do is move your jaw and your tongue and something is going to do something to that food to make it at least smushable enough for you to swallow it with a little bit of effort, maybe a lot of effort, but hopefully not obstructing or getting stuck. And sometimes kids do get stuck, and that's what happens when they gag, when they're trying to swallow, is they don't have the right tongue pattern, so the food gets stuck on the back of the tongue right where your gag is, and it's supposed to be there because it is a protector so that you don't put food down your throat that shouldn't be down there, that's not prepared well enough, or maybe something that's not really food, like kids that put stones and things like that in their mouth. But anyway, so what happens when you put a lot of food in your mouth is you don't have to use precise patterns to chew that food, because like I said, everything does something to that food. If you did that experience where you stuffed the food in your mouth, you will get that feeling. And then I want you to take a regular bite, and what happens is you bite in the front, you use your tongue to transfer it to one side or the other, you chew it up, sometimes you're transferring it across midline to the other side to finish chewing, but you will notice that you have a rotary chew of your jaw, and that chewing on one side with precise patterns is what allows you to get to that rotary chew, which allows you to like really tear through more challenging foods like we talked about, like meats and things like that. And so when your child is putting a lot of food in their mouth, they need some help to help their sensory system understand where the food needs to be and then how to get the motor system to get that food where it needs to go so that the child can chew it. So if your child likes to shove a lot of food in their mouth and just doing some of the things we talked about in the second video doesn't help and becomes frustrating for you or your child after maybe a few days or a week, and then maybe take some time off and try again. If that doesn't work, then it's probably time to find a speech pathologist that specializes, maybe an OT, that specializes in feeding and swallowing disorders. You just want to make sure that the feeding therapist also understands not just the sensory component, but also the motor component, because a lot of times I see in my experience, other professionals forget about the motor piece and they just work on sensory. And if you do that, you're not going to be as successful. Both of those pieces are what's going, or that your child has difficulty if your child is one of those kids that like to shove a lot of food in their mouth. And some adults are like that too, so it's not just the kids. But if you see that in your child and you're concerned and you can't find anybody in your area, please feel free to consult with me at feeding.com. Please like this video, please share it, and please subscribe. I look forward to teaching you more and I hope this was worth your time. Thank you and have a great day.